If you are over 60 and taking vitamin B12 every day, stop for a moment and listen carefully. I hear this question almost every week in my clinic. Doctor, I take B12 faithfully. Why am I still tired, foggy, dizzy, or experiencing numbness in my hands and feet? Just recently, a 68-year-old patient asked me the same thing. He had been taking vitamin B12 for more than 7 years. His blood tests looked normal, yet his energy was declining, his balance felt off, and his memory was getting worse. What surprised him was this. He was not lacking vitamin B12. He was taking it the wrong way. New research shows that one very common B12 mistake, especially in adults over 60, can block absorption and silently damage nerve function. I'm Dr. William Lee, and in this video, I will explain that mistake, why most doctors overlook it, and how to take vitamin B12 the correct way, so it actually supports your brain, nerves, and long-term energy. Before we dive in, drop a comment with your age and where you're watching from today. Are you taking B12 but still experiencing fatigue, brain fog, or numbness? Write your answer below, because your experience helps our entire community. And hit that subscribe button, because I share life-saving health strategies like this every week to help you thrive after 60. Most people believe that if their blood test shows a normal B12 level, everything must be fine. But in adults over 60, that assumption is often wrong. Vitamin B12 is essential for nerve function, brain health, red blood cell production, and energy metabolism. Without enough usable B12, nerves begin to malfunction. That is why early symptoms include tingling in the hands and feet, balance problems, fatigue, memory lapses, and brain fog. Here is the problem. As we age, our ability to absorb vitamin B12 drops sharply. By the age of 60, more than half of adults have reduced stomach acid. Stomach acid is required to separate B12 from food and supplements. Without enough acid, B12 passes through the body unused. I saw this clearly with one of my patients named Margaret, age 71. She complained of burning sensations in her feet and frequent dizziness. Her doctor checked her B12 level. It came back at 420, technically normal. She was told nothing was wrong, but her symptoms kept progressing. What most people do not realize is that a standard blood B12 test does not show how much B12 is actually entering your cells. It only shows how much is floating in your bloodstream. In older adults, B12 can appear normal in blood tests while the nerves are still starving. This is why so many seniors take B12 for years and feel no improvement. Now here is where the first major mistake happens. Most seniors take vitamin B12 as a standard tablet and swallow it with water. They assume it will be absorbed like any other vitamin. But in people over 60, this form often does not work. B12 absorption requires a protein called intrinsic factor produced in the stomach. With age, intrinsic factor production declines. Without it, swallowed B12 tablets are poorly absorbed. This is not rare. It is extremely common. That 68-year-old patient I mentioned earlier was taking B12 exactly as instructed every morning. Same dose, same brand, yet his nerves were still deteriorating. When we changed the form of B12, not the dose, his symptoms began to improve within weeks. This is why the form of vitamin B12 matters just as much as the amount. If you're finding this helpful, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this information. Now let us talk about the second mistake, and this one is extremely common. Many people take the wrong form of B12. If you look at most B12 supplements on store shelves, you will see one name again and again, cyanocobalamin. It is cheap, it is stable, and it is the least effective form for older adults. Cyanocobalamin is a synthetic form of B12. Your body must convert it into active B12 before it can be used. That conversion requires healthy liver function, proper enzyme activity, and adequate antioxidant capacity. In adults over 60, that conversion process often slows down. I saw this with a patient named Robert, aged 72. He had been taking cyanocobalamin for years. His blood levels looked acceptable, but he continued to experience numbness in his fingers and difficulty walking. When we switched him to methylcobalamin, an active form of B12, the change was noticeable. Within 1 month, his balance improved. Within 3 months, the numbness decreased significantly. Research shows that active forms of B12, such as methylcobalamin and adenosylcobalamin, are absorbed and utilized far more efficiently in older adults. Another critical issue is dosage timing. Many seniors take B12 once in the morning and assume that is enough. But B12 is water-soluble and cleared quickly from the bloodstream. In people with absorption issues, a single daily dose may not provide sustained levels for nerve repair. There is also a dangerous misunderstanding about injections. Some people believe that B12 injections are the only solution. In reality, injections are helpful in severe deficiency, but they are not always necessary. High-quality sublingual B12 taken correctly can be just as effective for many seniors. Sublingual forms bypass the stomach, an intrinsic factor allowing direct absorption through oral tissues. This is especially important for adults with low stomach acid or digestive issues. The key lesson here is simple. If you are over 60, swallowing a standard B12 tablet may give you normal lab numbers, but it may not protect your nerves. Now we come to the third mistake that surprises most seniors because it has nothing to do with dose or form. It has to do with timing and consistency. Many people take vitamin B12 only when they feel tired. They skip days. They stop when symptoms improve. Then they restart weeks later. Nerve tissue does not heal that way. Vitamin B12 is not a stimulant. It is a repair nutrient. Your nerves require steady daily availability of B12 to rebuild damaged myelin, the protective coating around nerves. Intermittent dosing interrupts this repair process. I saw this pattern in a 70-year-old patient named Elaine. She took B12 only on days when she felt exhausted. On those days, she felt slightly better, but her numbness, balance issues, and memory problems never improved. When she began taking B12 consistently every day without skipping, her symptoms started to stabilize. After 2 months, the tingling stopped progressing. After 4 months, her balance improved. Another overlooked issue is taking B12 at the wrong time of day. Many seniors take B12 late at night. For some, this can interfere with sleep. Poor sleep raises cortisol levels, increases inflammation, and slows nerve repair. For most seniors, the best time to take B12 is earlier in the day, preferably in the morning or early afternoon. This supports energy and nerve function without disrupting sleep. Hydration also matters more than people realize. Vitamin B12 works inside cells that rely on proper fluid balance. Chronic mild dehydration, common in older adults, reduces nutrient transport into nerve tissue. If you are taking B12 but rarely drink water, your results will be limited. Finally, many seniors take medications that interfere with B12 absorption or function. These include acid blockers, metformin, and certain antibiotics. This does not mean you should stop your medications. It means you must adjust how you support your B12 levels. By this point, you may realize something important. Most seniors are not doing one thing wrong. They are doing several small things wrong at the same time. Each mistake reduces the benefit slightly. Together, they can completely cancel out the effect of vitamin B12. Now, let me walk you through the correct vitamin B12 protocol for seniors. This is the approach I use with my own patients over 60. First, let us talk about the form. For most seniors, the best choices are methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin. These are active forms. Your body can use them immediately without conversion. Avoid relying solely on cyanocobalamin, especially if you have nerve symptoms. Second, delivery method matters. If you are over 60, swallowing a standard B12 tablet is often not enough. Sublingual B12 placed under the tongue and allowed to dissolve slowly bypasses many absorption problems. This alone can dramatically improve results. Third, dosage. For nerve and brain support in seniors, low doses often fail. Most older adults need higher amounts to overcome absorption barriers. A common effective range is 1,000 to 2,000 micrograms daily. Some people need more initially than less for maintenance. This is not dangerous. Vitamin B12 is water-soluble. Excess amounts are safely excreted. Fourth, consistency. B12 must be taken every day, not occasionally, not only when you feel tired. Nerve repair is slow. Symptoms often improve gradually over weeks to months, not overnight. Fifth, timing. For most seniors, take B12 in the morning or early afternoon. This supports daytime energy and reduces the risk of sleep disruption. If B12 makes you feel alert, do not take it late in the evening. Sixth, supportive nutrients. Vitamin B12 does not work alone. Folate and vitamin B6 are often needed for full nerve support. However, be cautious with high-dose folic acid. Natural folate or methylfolate is usually better tolerated. Seventh, monitoring progress. Do not judge success only by blood tests. Pay attention to symptoms. Are your hands less numb? Is your balance improving? Is your thinking clearer? These changes matter more than a number on a lab report. I had a patient age 75 who followed this exact protocol. After 3 months, her lab values changed only slightly, but her walking improved, her falls stopped, her confidence returned. That is real success. At this point, it is important to understand one critical truth. Vitamin B12 is powerful, but it is not magic. There are situations where B12 alone will not fully resolve symptoms. One of the most common issues is long-standing nerve damage. If nerve compression, spinal degeneration, or diabetes has been present for many years, B12 can support repair, but it cannot reverse severe structural damage overnight. Another overlooked factor is blood sugar control. High blood sugar damages nerves directly. In seniors with prediabetes or diabetes, nerve symptoms may persist unless glucose levels are addressed. Inflammation is another silent blocker. Chronic inflammation interferes with nerve signaling and nutrient delivery. Poor sleep, chronic stress, and sedentary habits all raise inflammatory markers. If these issues are ignored, B12 works harder and delivers less benefit. There is also the issue of misdiagnosis. Not all numbness, tingling, or weakness is caused by B12 deficiency. Conditions such as cervical spine compression, carpal tunnel syndrome, and peripheral neuropathy from other causes can mimic B12-related symptoms. This is why persistent or worsening symptoms should always be evaluated by a medical professional. Do not assume that more supplements will solve everything. I want to share a quick example. A 73-year-old man came to me frustrated. He had doubled his B12 dose on his own after reading online advice. His symptoms did not improve. Further evaluation revealed spinal stenosis. His nerves were being physically compressed. No amount of B12 could fix that. Once the correct diagnosis was made and appropriate treatment started, his B12 supplementation became supportive instead of disappointing. Now let us bring everything together into a clear action plan. If you are over 60 and taking vitamin B12, this is what matters most. First, stop focusing only on lab numbers. A normal B12 blood level does not guarantee healthy nerves or brain function. Pay attention to how you feel and how your body responds over time. Second, use the right form. Choose an active form of B12, such as methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin. These forms do not rely on conversion and work better in older adults. Third, choose the right delivery method. If you are over 60, avoid relying only on swallowed tablets. Sublingual B12 allows absorption without depending on stomach acid or intrinsic factor. Fourth, take an effective dose. For most seniors, 1,000 to 2,000 micrograms daily is a reasonable starting range. Some may need more initially than less for maintenance. Work with your doctor if you are unsure. Fifth, be consistent. Take B12 every day. Nerve repair is slow and steady. Skipping doses interrupts progress. Sixth, take it at the right time. Morning or early afternoon works best for most people. Avoid taking B12 late at night if it disrupts sleep. Seventh, support the process. Stay hydrated. Manage blood sugar. Address sleep and stress. These factors determine whether B12 can actually reach your nerves and brain. Eighth, know when to look deeper. If symptoms continue to worsen, do not assume B12 is the only answer. Seek proper evaluation for nerve compression, metabolic issues, or other underlying causes. I want to be very clear about this. Vitamin B12 taken the right way can protect nerves, support memory, and improve energy in many seniors. Taken the wrong way, it can appear to do nothing. The difference is not luck. It is understanding. Before we end, I want to leave you with one final thought. A woman in her early 70s came to see me after years of believing B12 simply did not work for her. After we reviewed her routine, nothing she was doing was technically wrong, but nothing was being done correctly either. She was using the wrong form, swallowing a tablet her body could not absorb well, taking it inconsistently, and judging success only by lab numbers. She changed just a few things: the form, the delivery method, the consistency. 3 months later, she told me something I will never forget. She said, "I feel steady again. I trust my feet when I walk. I do not lose words mid-sentence anymore." That is the difference between taking a supplement and using it correctly. If you are over 60, vitamin B12 is not optional, but how you take it matters more than most people realize. I encourage you to look at your current B12 routine tonight. Ask yourself one simple question. Is this actually supporting my nerves and brain, or am I just checking a box? Before you go, comment below with your age and where you're watching from. Tell me what form of B12 you are taking and what changes you are planning to make. I read every comment and love hearing from our community. If this video helped you understand something important about your health, share it with someone you care about. Many seniors are taking vitamin B12 the wrong way and do not know it. Thanks for watching. Don't forget to hit that subscribe button for more life-changing health tips designed specifically for seniors.